heartburn, reflux, and chest pains. Oh my.
Dr. Ryan Shelton with Tryon Medical Partners is here to explain heartburn, GERD, and when to worry. Dr. Shelton, thank you so much for being here today.
Hey guys, how's it going?
You. Okay, so what is the difference between heartburn, acid reflux, or GERD?
Yeah, so heartburn is what we feel, so that's the symptom. So acid reflux is actually truly what's happening. So our stomach makes acid. We need that for digestion. But if the acid in the stomach accidentally comes up our esophagus, then that can give us the burn because the esophagus was not meant to withstand that acid. It's not meant to be there. So that's what can give us that burning sensation. And GERD is just basically when it's happening more often, like more than twice a week on a regular basis, then we refer to it as GERD, gastroesophageal reflux disease.
Oh, okay. What about the chest pain? Why did I feel like I may have chest pains with that?
So the innervation for this area is not as specific to the brain. So, I mean, you're feeling the burn, actually. I mean, that's truly what you're feeling. So our esophagus was not meant to withstand the acid that can accidentally come up from the stomach through a sphincter muscle that usually is tightened to prevent the acid from flowing upwards. Right. So if for some reason, like if we're overweight or we've had a really large meal or eating some of the wrong things that can relax that sphincter, well then the acid can kind of come up the wrong way. So that's what you're feeling.
What are some signs of heartburn versus signs of a heart attack? Because if you're experiencing that feeling in your chest, someone might think, oh my gosh, I'm having a heart attack.
It can be confusing at first. Obviously, symptoms for a heart attack are a lot more severe. You may have some shortness of breath, you could be nauseous, sweaty, the pain might move to different areas. So the thing with reflux, it's a little bit more subtle and it lasts a lot longer. So we could feel like that burning sensation. We might be a little nauseous. It's just more about the timing. So if you're having kind of the burn and it's somewhat intermittent, but it's going on for hours or several days that's happening, well, that's way less likely to be a heart attack. Also, for true heart symptoms, if you're getting discomfort with exertion, so when you're exerting yourself, exercise, climbing stairs, that's more concerning for the heart. So for heartburn, it's truly more of the burn, but also people can have some breathing problems or coughing, or this sensation like you need to clear your throat, like something's kind of stuck but nothing will clear out. So that can be a different type of reflux where acid is coming up a lot farther and irritating the back of the throat. So it could be a lot of kind of random things we would not think about, like coughing, throat clearing, that could actually be heartburn related.
So if we eliminate the heart attack, how is heartburn treated?
So the first thing we want to do is get our weight down and think about our lifestyle. So what are we eating? Things like fried or fatty foods, caffeine, alcohol, those things really can worsen it. Acidic foods, so tomatoes, grapefruit, things that are good for us, but they have more acid. So if we're having acid that's made, which we need, but if it's coming up the wrong way, then those foods can really kind of worsen that. So first step is weight loss. Like that really helps the most. If you think about it, it's just when we have extra pressure, like for example in pregnancy. This is a common condition in pregnancy, especially towards the end, because there's only so much room, so baby is pushing. And same thing if we're overweight or if we've had, too many beers and we kind of get the bulging around the middle, so that causes extra pressure which pushes on this area so acid can travel upwards. So weight loss really is one of the best. You also don't want to have a large meal late at night. You don't want to eat a big meal anyway, but certainly not late at night and then go lay down, because if you think about it, it's gravity, so you're flat, so what's in the stomach, there's more likely that could push and acid could come up that way too. So
watch
those are
the
some
caffeine,
things.
the alcohol, fried foods, and don't eat it. You're no fun at all. You're just no fun.
So we just maybe cut those back. Maybe those are not an everyday thing. But if you are having those things regularly, I mean, truly, you're at higher risk to develop some heartburn eventually.
Okay. Dr. Ryan Shelton, thank you very much. He actually is fun. I'm just kidding. TryonMed.com. Go there for more information. TryonMed.com. It's great to see you.